Hi everyone, and welcome to this module on consent and communication using the acronym BRAINS. This is one of the most important skill sets you'll build as a doula because decisions don't happen in perfect conditions. They happen when people are tired, emotional, overstimulated, scared, or under pressure. And sometimes when they've been awake for 30 hours and haven't eaten a proper meal. So right from the start, I want to be crystal clear. Our role is not to make choices for clients. It's not to talk them into the birth plan or feeding plan we prefer. It's not to become the expert voice in the room. Our role is to help them slow the moment down, understand what's being proposed, and use their own voice so they can make informed decisions with dignity. And this isn't just a birth skill. This is a postpartum skill too. After baby arrives, there are still decisions: feeding, pumping, sleep and settling information, newborn procedures, visitors and boundaries, mental health support and referrals, and sometimes even safety planning. So today we'll talk about how BRAINS shows up in all of it. When we say informed consent, we're talking about understanding and choice. Informed consent means the client understands what's being recommended, why it's being recommended, what the benefits and risks are, and what alternatives exist, including the option of waiting, when waiting is clinically appropriate. Having time to ask questions, and it also means the choice is voluntary, not pressured, not shamed, not rushed when there's time, and not made because someone feels scared to ask questions. Now, doulas are not the medical team. We don't interpret clinical data, we don't diagnose, we don't prescribe, and we don't advise when somebody should choose. But we are incredibly helpful for informed consent because we can support the process of consent, helping the client ask questions, clarifying language, and supporting their nervous system so they can actually think. And I want to name something important. Postpartum consent matters just as much, sometimes more, because people are sleep deprived, exposed, physically recovering, and emotionally raw. So informed consent postpartum can look like helping someone ask, is this normal? What are my options? Who can help? What do we do next? And why does this matter? It matters so much because people may not remember every detail, but they often remember how they felt. Did they feel listened to? Did they feel respected? Did they feel included? That's true in the birth room, and it's also true at 2 a.m. postpartum when they're in tears saying, I can't do this. The way we respond in those moments can protect confidence, trust, and emotional safety, sometimes for years. A doula can't control outcomes, but we can absolutely influence the experience of care by helping clients feel heard, supported, and not alone. BRAINS is a simple acronym, simple framework for decision support. It's easy to remember and easy to use under pressure. The acronym BRAINS stands for benefits, risks, alternatives, intuition or values, what matters to the client, N for nothing or not now, what happens if we wait, and second opinion. And here's the key point. Your job is not to answer BRAINS for them. Your job is to help them ask the questions, then support them emotionally while they process what they hear. You are the steady hand on the shoulder, not the person steering the wheel. A fun and easy way for you to share this is telling your clients to remember to use your BRAINS, or at least remember your BRA. Benefits, risks, alternatives. I want to broaden your vision here because sometimes doulas think BRAINS is only for big hospital decisions. BRAINS is valuable in the hospital or during birth, although it also shows up in postpartum all the time, because postpartum is full of micro decisions that can feel enormous when you're exhausted. Examples might be, should we top up with formula tonight? Should we call a lactation consultant now or wait a few days? Should I call my GP about how I'm feeling, or is this normal? Do we accept this visit now from a friend or protect our rest? You're not making these decisions for them, but you can absolutely support calm, values-based thinking and help families access the right choice. So, when to use brains? Use brains when a recommendation appears, when a plan changes, or when you notice the client looking unsure, overwhelmed, or pressured. And when not to use it, we don't use brains as a weapon. We don't use it to pick a fight with staff, and we don't use it to delay urgent care if there truly isn't time. If there's an emergency, the conversation may need to be short. In those moments, even 1 or 2 scope-safe questions can help. For example, what's the main concern you're seeing? Or how urgent is this? Can you explain in 1 sentence what's happening and what you recommend? Even 20 seconds of clarity can change how someone remembers that moment. As in every situation, doulas must stay in scope. This is where your wording protects you. You can say, I can't give medical advice, but I can help you ask questions. Do you want a moment to clarify before deciding? Can you tell me what you heard them say? That's something to check with your care provider. That repeat back question is powerful. Sometimes the client nods but doesn't actually understand, especially postpartum when they're sleep deprived, teary or overwhelmed. Having them reflect back helps identify confusion without shame. In postpartum, you might also add, we can call your midwife, doctor, lactation consultant together if you'd like. You don't have to do this alone. Information versus advice. This is a big one. We provide evidence-based information. We don't give medical advice. Information sounds like, here are a few evidence-based resources. Or here are questions you can ask your midwife or doctor. Or do you want help writing these questions down? Advice sounds like, you should do this. Don't do that. Or I think you need. The line can feel subtle, especially when you care deeply, but it's everything. In postpartum, this is where people really want advice. They might ask you, is my baby getting enough? Should I stop breastfeeding? Is this reflux? Should I be worried about this bleeding? Is this anxiety normal? We can absolutely educate and normalise, but we stay out of diagnosing, prescribing or pushing one right way. Our safest, kindest path is normalise what's common, ask good questions and refer early when something is beyond our scope. Communication is vital in all walks of life. Hearing is a sensory experience and listening is a voluntary activity. The key principles of effective communication include clarity, avoid jargon and use simple language where possible. Active listening, you do that by paraphrasing and asking clarifying questions. Non-verbal cues, your body language, facial expressions and tone of voice. Empathy, so important and involves considering things from the other person's perspective. And feedback, important to ensure understanding. Reflective or active listening is one of your superpowers. Active listening involves making the decision to listen and concentrate on what is being said. It involves trying to understand the speaker's point of view, which may mean changing the paradigm or lens that you're looking through. It involves asking clarifying questions without judgment and being patient. As well as listening, you need to observe, not interrupting, and then confirming that you have understood correctly. And this is not just saying, oh, I understand. You confirm understanding by providing feedback and summarising the main points of the speaker's message to ensure that you're on the same page. A simple explanation is reflect back what you're hearing, content and emotion, then check in if you've got it right. For example, it sounds like you're worried that this is moving too fast. You feel torn, relief, and disappointment at the same time. Did I get that right? This is especially powerful in the postpartum period because sometimes the parent isn't asking for a solution, they're asking to be seen. When people feel accurately heard, their nervous system settles. And when the nervous system settles, decision making improves. Open questions keep the client in the driver's seat. Saying things like, how are you feeling about this? Or what matters right now? Rest, avoiding surgery, feeling in control? Or what would help you feel clearer? Avoid leading questions like, you don't want that, right? Because that plants your preference into the room. We want the client's values, not ours. And during the postpartum period, open questions can sound like, do you want reassurance, options, or practical help right now? What feels hardest today? What would make today 10% easier? Sometimes the best communication tool is slowing down. In intense moments, ask one question and then wait. Silence gives people space to think. If we fill every gap with talking, we unintentionally take power away. So, one question, a pause, then do you want to ask another question or do you feel ready? Would you like a moment to think? Do you want me to write this down so you don't have to hold it in your head? When decisions pop up, especially when people are tired or anxious, simple questions are gold. You're not interrogating anyone, you're helping the client get clarity, one step at a time. Here are some brains questions that work in real rooms. Benefits. Why this? Why now? Can you tell us the main reason you're recommending this today? What problem are we trying to prevent or solve? What's the goal for the next hour or two? And your doula support line to the client could be, do you feel like you understand the why behind this? Or do you want it explained more simply? Risks of doing it and risks of waiting or not doing it. What are the main risks for me and my baby if we do this? And what are the main risks if we don't do this right now? What side effects should we watch for? And a postpartum version could be, what would be a red flag that means we should get help today? Or what's normal for now and what isn't? And your doula support line, if it helps, ask for the top 2 risks, clear and practical. Alternatives. What else could we try? What are the other options right now? Is there a less invasive option that we can try first? Can we try this and reassess after a set amount of time? Postpartum, maybe, could we try a different position? Skin to skin? Is the alternative here a lactation consultant rather than guessing alone? And your doula support line, would you like help wording the alternatives question? Intuition or values, what matters most to the client? What matters most to you in this moment? What feels like your biggest priority right now? Rest, staying mobile, feeling calm? What would help you to feel safe and steady as we decide? And postpartum might be what matters most tonight. More sleep, less pain, protecting supply, or reducing stress. In your doula support line, there isn't one perfect choice. There's a choice that fits your values and your situation. Nothing or not now. Can we pause? What happens if we wait? How urgent is this decision? What happens if we wait 30 minutes or an hour? What would we be watching for while we wait? When would you want us to decide by? And postpartum, maybe, is this a call today situation or something we can monitor and review tomorrow? And your doula support line, if it's safe to pause, even a short pause can help you feel clearer. And second opinion, when appropriate. This is not about being difficult. It's about making sure the client feels confident and well supported, especially when the decision is big. The information feels unclear or there's time. So some birth examples could be, can you explain what another provider might recommend in this situation? Or could we ask for a few minutes to talk privately before deciding? And postpartum questions may be, would it help to involve a specialist like a lactation consultant? Or can we arrange a follow-up call or review it if it doesn't improve within 24 hours? Your doula support line, it's completely okay to want a second set of eyes or the right specialist. That's not overreacting. That's good care. And 2 extra questions that make brains work even better. Can you say that in plain language? Can you explain that more simply to me? Can you give us the short version? And then your superpower, what did you hear them say? What feels clear and what still feels confusing? Sometimes providers answer beautifully. Sometimes they're brief. Either way, your job stays the same. Keep the client calm and oriented. Help them ask the next question and remind them through your presence and your words that their voice still matters. There are red flags doulas can notice around consent without diagnosing anything. If the client looks frozen, goes silent, or seems too scared to speak, remember, silence isn't consent. If people are talking around them, dismissing them, or pressuring them when time exists, we can support the client back into the centre. That might look like us saying, would you like a moment to ask questions before deciding? Or quietly saying, would you like help wording what you want to ask? Or would it help if we wrote the questions down so you can read them out? Our doula response, pause, clarify, and support voice and refer is a simple scope-safe recipe for what you do when a client seems overwhelmed, unsure, pressured, or not fully included in the decision during pregnancy, birth, or postpartum. So the pause, you help slow the moment down so the client's nervous system can catch up. Let's just take one breath. Or do you want a moment before you decide? Or would you like a moment of quiet? Clarify. You help make sure they actually understand what's being proposed without interpreting clinically. Can you tell me what you heard them say? Do you want me to help you ask for the short version? Or what's the main reason they're recommending this? Support voice. You help the client use their own words instead of speaking over them or speaking for them. What do you want to ask next? Would you like help wording that question? Do you want to say that, or would you like me to prompt the provider to explain it more simply? And refer. If it's beyond doula scope or something feels medically or emotionally concerning, you encourage the next right professional support, calmly and without alarm. I'm not a medical provider, but that sounds important to check in about. Let's call your midwife or doctor now. This is something a lactation consultant could really help with. Want me to help you find one? In short, you slow things down, make it clearer, keep the client in the centre, and connect them to appropriate care when needed. Let's do a postpartum scenario example, because this is where brains is incredibly useful. The parent says, feeding hurts and baby's unsettled. Should I top up? Should I pump? I don't know what to do. A scope safe flow might sound like, that sounds really hard. Do you want support right now or options? And depending on what they say, you could respond with, okay, let's use brains. What's the benefit of topping up tonight? Rest, calmer baby, less pressure? What are the risks? Maybe supply impact, maybe none, depending on the plan. What alternatives are there? Different positioning, skin to skin, hand expression. And what does your intuition say? What feels most supportive and sustainable tonight? Then you bring it home with referral. This sounds like something the lactation consultant could really help with. Would you like help contacting one today? That's doula care. Calm, supportive, non-judgmental, and referral when needed. So to recap, brains isn't about controlling birth or controlling postpartum. It's about protecting dignity and voice. Your calm, scope-safe communication can be the difference between a client feeling steamrolled and a client feeling included, respected, and steady. Gain your next foundational skills badge by completing the following quiz to review your learning. And once again, thanks so much for being here, and I'll see you in the next module.